This video is the fourth in a series of 6 videos created to provide an overview of the Midmark digital spirometer. This video will guide you through performing a spirometry test. Always refer to the appropriate technical documentation for the complete list of instructions, safety alerts, and sequence of procedures before conducting any service or maintenance operations. The forced vital capacity, or FVC test, is usually the first spirometry test prescribed. Using the Midmark digital spirometer, the user can perform an FVC or FVC loop by selecting FVC. To perform an FVC test, double-click on the IQ Manager icon and then click on either the Patient List button or New Patient button. In this example, we will be using an existing patient. Search for the patient's information and click Start Test from the patient data screen. Then click on the play icon next to the Midmark digital spirometer. For information on creating a new patient or other methods of starting a test, please review the IQ Manager Operation Manual. It is essential that the patient's race, age, sex at birth, and height, also known as rash, are entered correctly. If any of the rash values are missing or unspecified, the software will warn the user. Click on the orange Missing Patient Info button, the orange warning icon, or the patient's name at the top of the screen to enter any missing or incorrect data. Smoking history can also be entered here. If the patient is a smoker and you have entered smoking history information, the test will display a lung age and COPD risk for the patient. This information is often useful for smoking cessation. Press Save when done. Now we will review the proper patient preparation before beginning spirometry testing. Reliable and reproducible spirometry results with fewer repeats depend on proper patient preparation, coaching, and patient effort. You are the key to successfully guiding the patient through this testing process. The FVC test screen contains a link to 2 demo videos that can help instruct the patients on how to execute the test. Access the link by clicking on the FVC demo button on the test screen. A sitting position is recommended during testing, as it may be safer for the patient if they experience syncope or dizziness while performing the forced expiratory maneuver. If prior testing took place with the patient standing, you can perform a new test with them sitting. But make a note of the change. If a patient stands during testing, it is recommended that a chair with arms and without wheels be placed directly behind them in the event that the patient needs to be seated quickly. Ask the patient to loosen any restrictive clothing. If the patient has dentures, have them place them in a cup during testing. Use of a nose clip is highly recommended during the testing procedure. Avoid cross-contamination by disposing of each disposable mouthpiece and replacing it with a new one for each patient. It is recommended that you explain the purpose of spirometry to your patient. The purpose of spirometry is to measure how much air can be taken into the patient's lungs and how much air can be blown out of the patient's lungs hard and fast. It's kind of like blowing out birthday candles on a birthday cake. We want the patient to blow out until their lungs are all the way empty. Provide the following patient instructions. Advise the patient that you will be performing a minimum of 3 and a maximum of 8 testing maneuvers. Instruct the patient to keep shoulders back and the chin up when blowing, and do not bend forward as they exhale. Advise the patient that if they begin to lean forward, you will remind them to sit back up. And when instructed, they will take a deep breath in and then place the mouthpiece on top of their tongue with their teeth and lips around it to create a seal. The patient will then blast out as hard and as fast as they can for as long as they can. Instruct the patient to not block the opening of the mouthpiece with the tongue or teeth. Advise the patient that you will be telling them to continue to blast the air out hard and fast. And even when they feel like they have no air left, keep going until told to inhale or stop. After patient instruction is given, it is essential that you demonstrate the correct way to perform the test. Having a patient visually focus on something at eye level, such as an incentive screen, can help them maintain correct posture, which will result in better test performance. There are 5 incentive screens to choose from in the IQ Manager software. For pediatric patients, it is recommended to use an incentive screen to help them successfully complete the maneuver. Now it is time to perform an FVC test with your patient. FVC will be selected by default. First, get a new disposable mouthpiece and open the package from the end closest to the single pin. This is the exhalation end of the mouthpiece and is safe to handle. You should avoid handling the patient inhalation side of the mouthpiece. Open the door to the digital spirometer and align the pins of the mouthpiece with the ports in the device. Press the mouthpiece into the ports. Remove the plastic wrapper from the mouthpiece and discard. Inspect the mouthpiece to assure no plastic remains. Now, close and latch the spirometer door. Hand your patient nose clips and have them put them on. Then, hand them the digital spirometer. The digital spirometer is easy to grasp and control. However, your pediatric patients with smaller hands will have a much easier time holding the device with both hands. Instruct the patient to hold the spirometer up and to the side of their face. For a pre-bronchodilator test, select Start Pre. Once Start Pre is selected, an incentive selection screen appears. Select the desired incentive. Do not click on Start until the patient is ready. The device will take a few seconds to zero. Make sure there is no movement of air through the spirometer while it is zeroing. Now, it's time to coach your patient and have them conduct their first maneuver. It is suggested that you wait at least 1 minute or until the patient is ready to perform the next maneuver. It is also recommended that you stand to the side of the patient to best support them during the testing process. When the patient is ready, click Continue to conduct the next maneuver. Repeat the procedure a third time or until a patient has 2 maneuvers that are reproducible or match. The digital spirometer interpretation software will pick the best test. If you wish to override this software and change the best test or accept or reject a specific maneuver, you can do so from the patient testing screen. If a pre- and post-bronchodilator test are being done, it is now time to administer the bronchodilator. Allow ample time for the medication to take effect. From the acquisition screen or the report review screen, select Start Post to perform a post-bronchodilator test. Ensure a bronchodilator is selected from the drop-down list before returning to the review screen. Post-bronchodilator FVC tests are performed the same way as pre-bronchodilator FVC tests. Once a post-bronchodilator test has been performed, no more pre-bronchodilator tests can be acquired. After the patient has completed the number of required tests, click Review in the lower right corner of the test screen. This will display the View Report screen. After reviewing the test and ensuring it is acceptable, select your name from the technician drop-down. Then, to save the report, select Save from the review screen. Once the patient has successfully completed their spirometry maneuvers, the disposable mouthpiece can be ejected from the spirometer. To eject the disposable mouthpiece, open the spirometer door and use your thumb to press down on the eject lever. The mouthpiece will drop into the trash receptacle. This concludes Video 4. Continue to Video 5 for more information about reviewing test results. For more detailed information about your device, please refer to the Midmark Digital Spirometer User Guide. For further support, contact Midmark Technical Service at 1-844-856-1230, option 2.